let's give people the lay of the land of what it would look like to eat throughout the day. Low carb, trying to fix insulin resistance.
Perfect. Okay. So I think a great first meal is eggs. So if you're doing maybe like 4 eggs, that's going to get you close to the 30 grams of protein. Maybe a couple pieces of bacon on the side, or like a sausage on the side, or some cheese on top. That's going to get you past. Maybe you put some protein in your coffee, like 10 grams of protein in your coffee. That helps boost it up. Now, if you want to add some carbohydrates to that, you could maybe put some beans on the side. I love doing like broccoli or like leftover roasted vegetables in my eggs. But that's pretty much all you need. If you want to add some carbohydrates, add some, I love making homemade sourdough bread. So I might have like half a slice of homemade sourdough bread with my eggs. Have it at the end of the meal. So food order does matter. At each meal, I want you to think about having your non-starchy vegetables first, then your protein and fat, and then the starches or whatever sugar you're having. Another great example there, Jesse, would be like a cup of blackberries or, a cup of mixed berries. Blackberries, raspberries, and strawberries are going to be the highest in fiber, the lowest in sugar compared to blueberries. Maybe you want some avocado on the side for some healthy fats. So some sort of egg scramble, maybe some berries on the side. That's a great first meal. Now, when you're thinking about your next 2 meals, obviously I eat meat. So if you're a vegan or a vegetarian, you have to get creative, and you're probably going to need a branched chain amino acid supplement to get the proper amount of leucine to trigger that muscle protein synthesis. But 5 to 6 ounces of meat in general is a good estimate. So in cooked meat, you can estimate there's about 7 grams of protein per ounce of cooked meat, right? So 7 times 5, what is that? 35?
Yeah.
Okay. So 7 times 5, 35. So 5 ounces of like rotisserie chicken breast, for example. Weigh it out, measure it out until you get used to it. But a lot of people are having like 3 ounces of chicken. It's like, you're close. It's not that far off. So maybe you have some rotisserie chicken breast, heat up some, I like a little pea bowl. So I'll do like 3/4 of a cup of peas, and I'll heat those up, and I'll put some chicken in. And then I'm going to put some, like 1/8 of a cup of walnuts in, and maybe 1/8 of a cup of feta cheese in. Sometimes I'll do like beans in there as well, like garbanzo beans, maybe a 1/4 cup of those. So you're getting your protein, right, with the chicken. You're getting your healthy fats from the walnuts and the avocado, maybe some cheese, shredded cheese, feta cheese, whatever you want. And then you have a lot of fiber from the peas and the walnuts. So think protein, fat, fiber, or fiber. I don't know, however you want to think. I think protein, fat, fiber is the easiest way to say it. So then at dinner, for example, maybe you have, if you're used to having spaghetti, right? Let's change that a little bit. Instead of having a bunch of noodles on the bottom from white pasta, change your pasta source. We use the Bonza chickpea pasta. So it's higher in protein, higher in fiber, a much lower blood glucose response. You still want to watch the portions. So maybe I'm having like 3/4 of a cup of cooked pasta, and I'm loading it up with the meat sauce. And then I put some, more Parmesan or shredded cheese on top, depending on your calorie goals. That's the thing, Jesse. It's like, if your goal is to gain weight or your goal is to lose weight, it's not that much of a different approach. You just adjust your portion sizes for the calories, but you still want to eat in a way that keeps insulin low, so that the mass that you're putting on or taking off is healthy, So either we're losing fat or we're gaining muscle. So we want to eat this way regardless. So for dessert, if you want dessert, I would do like a chocolate peanut butter cup that you can make with coconut oil and some peanut butter and unsweetened baker's chocolate, a little cocoa powder, a drop of stevia. You put them in these mini candy cups, like the mini muffins, sprinkle some salt on top. And that's a really delicious meal ender if you want to have dessert, something like that. So notice I didn't say any snacks, but if you want some snacks, what I typically recommend, if people are really feeling like they need a snack, it's usually because they're under eating at their meals. And so I say, whatever typical snack you're going to have, tack it onto the meal, like a piece of string cheese or a hard-boiled egg. All of those would be really good to add to that lunch to up the protein content. Like if you want a protein bar, get one that has low added sugar. If people are really trying to gain muscle mass, I recommend a protein shake, like right after working out, ideally. Another little hack is if you're doing intense exercise, again, you can tolerate more carbs. You want to replenish the muscle glycogen stores. That was a mistake I was making for a long time. I was trying to get back into running. I felt gassed at every workout. I'm like, oh my gosh, like I'm too young for this. I'm too young to feel this way. And so I started increasing my carbs a little bit at each meal and then refueling after exercise properly. And that helped a lot. So having some sort of protein shake, maybe you put some oats in there, maybe some pumpkin seeds. So where is my protein? Where is my fat? Where is my fiber? Think about that in every single meal. Focusing first on getting 30 grams of protein per meal. That's going to really set you up for long-term weight loss and maintenance success. And Jesse, there's been really good studies that have compared different dietary approaches for when you're losing weight. How do we preserve as much lean muscle mass as possible? And the high protein diet wins hands down. It wins over the low fat diet. It wins over the low carb diet. It wins over the low calorie diet. So what I like to say is, yes, we want an energy deficit over the long term, but we don't want a protein deficit. So that's how like a regular day of eating might look. And there's so many great options and there's so many simple swaps. Like if you like yogurt for breakfast, fantastic. But instead of getting the Yoplait stuff with like 12 grams of added sugar, get the full fat Chobani or whatever your fat goals are. Get some high quality Greek yogurt. Put a couple drops of stevia in there, mix in some berries, maybe put some vanilla in, make your own flavored yogurt. You've already increased the protein content. So I think if you're already doing smoothies and you're doing almond milk, put in the Fairlife milk because it has a ton more protein in it. You're going to be upping your protein content. So just thinking about what am I eating right now? How can I change just a little bit at a time? Like what's a minor tweak that I can make? What pasta am I having? How can I optimize the pasta? What pasta sauce am I having? There's so much added sugar in a lot of spaghetti sauces. Choose a brand that doesn't have the added sugar. So it's not so much like an overhaul of your diet, but like these little micro changes over time that really add up.
You've talked about stevia a couple times. I think it's stevia and monk fruit. Those are the two sweeteners that you use,
Yeah,
correct?
that's correct. That study came out on erythritol. I really respect Dr. Peter Attia. It was in February of 23, and he kind of poo-pooed the study. But in general, I think erythritol causes a lot of GI side effects, a lot of gas, bloating, those kinds of things. So monk fruit and stevia don't typically cause those. And so it's like, well, let's just stick with those instead. Sometimes for baking, I'll use allulose, but stevia and monk fruit are my typical go-tos. I usually use the sweet leaf stevia drops. Like hot chocolate is a great example, Jesse. Like most people are using the powdered things from the store. You can make such good hot chocolate that's high in protein with the Fairlife milk, some cocoa powder, a couple drops of stevia. You can put some cinnamon in it to make it really good. But those are the types of little simple swaps that we want to start encouraging people to make to reduce their sugar intake.
All right, so we've gone over the diet quite in detail here. As somebody adopts a low carb diet, again with the goal of preventing or reversing insulin resistance, any specific supplements that you recommend to people?
Yeah, creatine would be one. I think creatine, especially when you're trying to build muscle, can be really beneficial. I personally use about 5 grams a day, especially on my workout days. For people that don't eat fatty fish a couple times a week, some sort of omega-3 fatty acid can be good. You want to be careful about. I typically recommend like the cold press kind or like the algae because you hear about some of them going rancid and there's issues there. So a really clean omega-3 fatty acid supplementation can be good. Branched chain amino acids can be a good supplement, especially if people aren't eating a lot of protein or if they're plant-based or if they're vegan or they're vegetarian, because there's just animal-based products are a higher quality of protein because they have a higher amount of the essential amino acids, leucine being one of them. So a branched chain amino acid supplement might be good to consider. I always say run any supplement by your physician. I'm a physical therapist. I don't have the scope of practice to be able to prescribe medications, give supplements, but I can make those general recommendations and then say run it by your physician.
All right, so we talked about having 3 meals a day. the upping of the protein. If you're going to have snacks, ideally pair it with the meal at the end of the meal. For somebody that wants to add in intermittent fasting, how do you recommend they begin?
Great question. So, I think Dr. Fung wrote in one of his books, The Complete Guide to Fasting. He said, there's two methods to fasting. You can dip your toe in or you can just jump in. I think he recommends just jumping in. I prefer the tipping the toe in method just from a psychological standpoint. I work mostly with women. I think we come with a host of other mental and emotional issues that I don't know, maybe men don't have to deal with when they're fasting. But a lot of women have a history of an eating disorder, some sort. I had exercise bulimia in high school, which is where like I exercised off anything that I ate. I lost my period for 10 months. A third of the girls in our high school class had some sort of eating disorder. So I'm very sensitive to that. And that's why I really recommend starting with a 12-hour fast. But if you want to progress past that, I would say do 3 meals within a 10-hour eating window, and then compress it down to 2 meals and a high protein snack. So that's really where we're getting into the 16-8. You're fasting for 16 hours, you're eating for 8 hours a day. Maybe your first meal is at 10, your last meal is at 6. You can still do 3 meals a day in that schedule as well. But a lot of people like the 2 meals and 1 snack just for calorie control. And then that's kind of a nice place for people to stay throughout their weight loss journey, with sprinkling in some longer fasts to either offset a holiday. Like at the time of this recording, it was just Thanksgiving. So maybe you want to do a longer fast to kind of compensate for any overeating that happened. Autophagy is fantastic. That's going to kick in after about 8 hours of a clean fast. I don't know about you, but I think the leaner I am, the harder fasting is for me. So if people have a lot of weight to lose, fasting is going to probably be easier for them, especially once they're fat adapted. So I recommend kind of a lower carb diet for a few weeks, maybe a couple months, and then going into the fasting. It's just going to be more comfortable that way. But you can do longer fasting. 1 meal a day, for example, is kind of a nice reset amount, but be sure that meal is portion controlled, because if you're eating, 2,000 calories in 1 meal, you're not going to be losing any weight. So I think that's important to keep it calorie controlled, portion controlled, 500 to 600 calories. But that to me is not going to fuel your body long term. 1 meal a day it's just not good for your muscle mass long term. So I think that that's a strategy that we can sprinkle in as needed for a reset or a plateau buster. But on a normal day-to-day basis, I really like to see people fueling their bodies, because from my experience with coaching, from my personal experience, you're going to have a lot less rebound eating if you're having those consistent meal times.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
If you have a high fasting insulin, if you have excess abdominal fat, if you have high blood pressure, high triglycerides, low HDL, low energy, frequent carb cravings, those are all signs of insulin resistance. Insulin and inflammation are hand in hand.